In today's conversation, I'm chatting with Dr. Luke Machen. We're going to be discussing the topic of testosterone and testosterone replacement therapy and its relevance to the veteran population. Of particular note, we're going to be going over what is testosterone and look at the science behind it. We're also going to find out what the symptoms are of low testosterone and the potential remedies and therapies that you can use in order to address it. So stay tuned to this episode. And also, you're going to want to stay tuned to the broader topic of testosterone and hormonal health for the veteran population that we'll be getting into in future episodes. And if you haven't done so already, make sure to smash that like button and give us a subscribe. I'd like to thank today's sponsor, Natesto. Natesto is an FDA-approved testosterone replacement therapy. For those of you that are suffering from low testosterone and want to know more, head to natesto.com for more information. All right, folks, today we're talking about testosterone, and I've got Dr. Luke Machen on the podcast today, and we're going to talk about his paper. So he wrote a scientific paper. I know it's kind of a big deal. It's called Direct Conversion from Long-Acting Testosterone Replacement Therapy to Natesto Allows for Spermatogenesis Resumption, Proof of Concept. All right, so for all you crayon eaters out there, we're going to bring this down a level, and we're actually going to get into the nitty gritty so that you can follow along, so that you don't need a biochemistry degree to actually understand what's going on here. And that's the point of today's conversation. So Dr. Luke Machen, welcome to the podcast. And how are you doing today?
I'm good, man. Thanks a lot for having me.
Absolutely. Absolutely. I really started the podcast to talk to smart people like yourself. So this is always a hoot.
We'll see. Hopefully I don't let you we'll see. Don't speak too soon. I don't know.
Well, judging by the fact that you helped co-author this paper, I'm pretty convinced that you know what's going on. So I want to get right into the conversation, because testosterone is obviously a male sex hormone. I think starting at that level, we can all understand what it's there for. But we'll get into the details of why it's important, especially in the veteran community, because this is just something that has piqued my interest over the last few years, because hormonal health is hitting the radar a little bit more for all those veterans that serve, especially over the last 20 years in the global war on terror. We were exposed to a lot of toxins. We were exposed to a lot of radiation. These things likely have an effect on our hormones. In case in point, I'm getting my testosterone tested again. It has been consistently low. And I kind of want to know why. And I also want to know what can be the therapies moving forward. So now that I've got you here, Doc, let's get right into it. Like, what is testosterone replacement therapy, and why would somebody, veteran or not, even consider going down that path?
Yeah, man. So I guess starting at so low testosterone is basically when our bodies just don't make enough testosterone. And 90% of our testosterone comes from our testicles, maybe 5 or 10% comes from our adrenal glands. So it's basically when your testicles aren't making enough testosterone. And so, I mean, testosterone replacement therapy, low testosterone is a medical diagnosis, and the testosterone replacement therapy is the medical treatment to get you back into the sort of normal, healthy range of testosterone. Typically our testosterones will peak sometimes in our 30s or 40s, and then kind of drift down slowly but surely from there. And that's probably due to a few different things. Some of it is we're getting older, our testicles not working quite as well over time, but then also from we have medical problems that start to accumulate that lead to our testicles not working quite as well. We gain weight, we get high blood pressure, we get cholesterol disease, kind of all the above. And so it gets more common. I guess our testosterones get lower as we get older, typically.
Right on. Give me a second. I'm just sorting out a mic issue. That was great. That was great, by the way.
Thanks.
Muted right now. Is my audio okay on your end? Okay.
Me.
Okay. All right. Yeah, weird. All right. We'll carry on from here. All right. So testosterone is an important hormone for men. Understood. You talked about low testosterone. So let's define that. What would typically low testosterone look like for, let's say, a man? I'm in my 40s, so let's use 40s as a baseline. For somebody in your 40s, and I'm relatively active, I think I sleep well, I think I eat relatively well. What should my free testosterone be at?
And so there's a few things that go into this. So technically, to like the clinical diagnosis of low testosterone, it's symptoms plus a kind of some lab levels below a certain threshold. The lab threshold is somewhat debatable. I think if you look at the American Urological Association, that's sort of the medical body that oversees all the urologists, and they issue guidelines to kind of help us out in our day-to-day practices. And they say less than 300. I think there's some push, and that should be when I'm talking about that, I'm talking about a total testosterone.
Yeah.
There's some, I believe there's maybe a similar European document that sort of advocates for about 350. I will say I kind of use a cutoff of roughly around 400. Less than that for your total testosterone plus symptoms are the guys who I talk about treatment with. And the reason for that is right around 400-ish is probably the cutoff for the lowest 33rd percentile. Does that make sense? Mm-hmm. And for guys in our age, like upper 30s, low 40s, that value is actually probably a little above 400. And then in guys, in their 60s or 70s, it's probably in the mid to upper 300s is sort of the cutoff for that lower 33rd percentile. And so that's kind of what, that's sort of the cutoff that I use to determine, hey, is testosterone possibly what's causing you to have all these symptoms? And when we talk about these symptoms, it can be things like low energy, sexual function issues, like trouble with your erections. It could be low libido, you're gaining weight, you're not seeing the same kind of results in the gym anymore, less stamina, lower mood. Those are the kind of symptoms that could be from low testosterone.
I'm glad you mentioned all those symptoms, because what I'm seeing, I'm experiencing some of those as well. And from my lifestyle, I'm technically doing all the right things. I'm eating well, I'm going to bed early, I'm taking care of my mental health, but it just seems like I'm low energy. And based off my blood work from the past few years, it never seems to get past 350. So by your definition, that would kind of be the cutoff point where you'd be like, okay, something's not quite working here. So what would be impeding me from having my testosterone rise? Is it something chronic? What is something that you typically see that can cause this? And then how do we start changing the course so that free testosterone levels can actually start ticking back upwards?
I mean, the truth of it is the vast majority of the times it's hard to pin it down on one thing. But the reason is, for whatever reason, your testicles just aren't producing enough of it. Mm-hmm. And there can be other symptoms. Sometimes your brain isn't making enough of the signal to tell your testicles to do it. And there are certain lab tests we do up front to sort of rule out potentially something nasty that could be causing it. But most of the time, it's just your testicles are underfunctioning. But why are they underfunctioning? We don't know. Is most of the time is the honest truth of it.
So let's get into that then, because I really want to discuss. You talk about brain functioning. Now, for some of us out there, we may not make the link between your testicles and your brain, right? Like brain 1, brain 2, maybe. But
which one's 1 and which one's 2 is up for debate. Yeah,
it's up for debate, right? Which one do you think with more? I think it's dependent on age. But in terms of how this system works, why is the brain important in terms of testicular function? And if I can add one more thing in there, is low production of testosterone that's related obviously to your testicles, is that what we also call hypogonadism, or is that something completely different?
So you're exactly right for the second part. Hypogonadism is the silver dollar word for low testosterone.
Nice.
Yeah, you're exactly right. But yeah, man, so there is a link between our brain and our testicles, and that's kind of how the levels of these hormones in our bodies get controlled or regulated. And so basically, the fancy name for it is the hypothalamic-pituitary-gonadal axis. But basically, like, it's a connection. There's sort of a link between our brain and our testicles. Our brain sort of senses the levels of hormones in our bodies, and then it has these signals that it can either crank up or crank down depending on what the levels are in our bodies. And so if it as an example, if it senses that it's low, then it turns the signal up. But then if your testosterone levels are good, then it kind of keeps it down at a normal level. And that's sort of how I think about how I explain it to patients.
Okay.
And so there are certain things, like, I mean, it's a very rare, but like if you have some sort of brain mass or something, like, there are things where the testicles aren't getting that signal because of things going on with our brain.
Okay. You mentioned hypothalamus, you mentioned pituitary. So this is some grade 9 science, and it's right in my wheelhouse because I used to teach grade 9 science.
Nice.
This is awesome. What then, in terms of that axis, can go wrong starting from, let's say, the top down? So the hypothalamus, like, what is that doing and how is that related?
And so it has a few functions, but I mean, for our purposes, for my purposes as a urologist, it makes something called GnRH, which stands for, like, gonadotropin releasing hormone, which is a direct signal to the pituitary gland. And then the pituitary gland makes a couple different signals that are hormones that tell our testicle to do its job. One of them is called follicle stimulating hormone, which we often abbreviate as FSH, and that tells our testicles to make sperm. The other one is Leydig hormone, and that basically is a signal to our testicles to tell them to make testosterone.
Interesting. Okay. So the pituitary, being the quote unquote master gland, needs to be getting the signals from the hypothalamus. Mm-hmm. And then once that signal gets sent, depending on if it's a very strong or weak signal, will produce more or less FSH, LH based on dependencies. So how does that work? If you need to produce, let's say, more testosterone, is there just a regular cadence in which it's produced, or is it dependent on certain activities or certain environmental factors that helps you produce more testosterone? Fellas, bring it in. Nice and tight. Bring it in. Nice and tight. We need to talk about it. All right, seriously. We need to talk about something that most of us don't want to talk about. That's why I put on my nice blue dress shirt to bring a bit of seriousness to an often hilarious topic. But your sexual health is no joke. Seriously, though, sexual health needs a lot more attention than it's been given. Let me go over a few things here. Research has shown that regular sex, 1 to 2 times per week, can reduce the risk of cardiovascular mortality by 50%. Bring that one to your wife right now. Lower the risk of prostate cancer by 33% and reinvigorate your mind and body. The problem is 40% of men in their 40s, 50% of men in their 50s, and 60% of men in their 60s experience some form of erectile dysfunction. This is even worse in the veteran community. On top of all this, erectile dysfunction is correlated with a future cardiovascular event and is an early warning sign of a future issue. This is why Dr. Elliott, board certified urologist and friend of the podcast, has created this one-of-a-kind, first in its category, revolutionary device called the Firm Tech Ring. This high-speed tech for your dick will give you real-time data and allow you to see how many nocturnal erections you get every night, which can be a great bit of data that you can bring to your doctor for a future conversation. Not only that, this data could literally save your life. You know, I'm all about improving the health and lives of the veteran community, and that's why I've paired up with Dr. Elliott Justin to provide you with a 10% discount if you head to the link that's here in the description to get yourself your first Firm Tech Ring if you use the code DMorrow at checkout. So head to the link in the description and start tracking
so that you can start banging. All right, brother. So go do what you got to do and be one of the first to bring a whole new meaning to being hard to kill. I want to be able to save you almost $4,000 per year. If you haven't got yourself a copy of The Nimble Warrior, this is my first book, and it is all based on what I've done in order to get myself out of the pain cave. Let me explain. Over 60% of Canadian Armed Forces veterans are experiencing chronic pain. Of all the medical releases, about 42% are musculoskeletal injuries. If we boil that down, a lot of us are suffering from back, knee, and hip injuries. What that means is we're experiencing high levels of pain, which reduce your quality of life. If you want to change that, I recommend getting a copy of my book, The Nimble Warrior, right here. You're going to be able to find a copy on Amazon, and you're going to be able to start doing the protocol that I use to help myself get out of the pain cave when I hurt my back. So head over to Amazon right now. Description is in the bio. Link is in the bio, and you're going to be able to get your own copy in time for the Christmas season so that you can start moving and grooving and feeling a lot better about yourself. So head to the link, head to the description, and get yourself a copy of The Nimble Warrior. Peace.
You're exactly right. So if things are working normally, there is this sort of rhythm or sort of pulsatile nature of that your hypothalamus releasing that hormone to tell your pituitary to do its thing, just at sort of kind of regular intervals.
Interesting. Okay. And in your paper, you talked about spermatogenesis, and that would be related to the follicle stimulating hormone. Am I correct?
That's exactly right.
Okay. So for somebody that's taking, let's say, testosterone replacement therapy, why is spermatogenesis, and I guess we should talk about like what that is, why should that be something on their radar? Why is it an important concept that needs a look?
Yeah, so I think this is very important. And unfortunately, I think a lot of guys who get prescribed testosterone don't necessarily get told this, especially in younger guys where it's the most relevant, where testosterone is basically, to some extent, most of the time, male birth control. When you get started on exogenous testosterone, typically it will shut off your sperm production. And that's when we say spermatogenesis, once again, that's our fancy word for sperm production.
Mm-hmm.
And the reason for that, and this dovetails nicely with what we were just talking about, where when we're getting testosterone exogenously, so whether we're injecting it into our bodies, whether we're putting on cream, where we're getting it from outside, our hypothalamus and our pituitary gland sense that, hey, our testosterone's good, let's shut off those signals to tell the testicle to do its job. And so that the pituitary gland will stop secreting that FSH, that LH, so the testicles aren't getting the signals anymore to do their job. Does that make sense?
Yeah. I didn't know that, actually. I thought it would have been the opposite, right? You're getting testosterone jammed into your system. Let's turn up spermatogenesis. Let's be as fertile as humanly possible, but it's the exact opposite. That's really interesting.
It's paradoxical because we need testosterone to make sperm, but it's that intratesticular testosterone. We need our own testosterone to make sperm. And so when we get it from outside, it'll shut off our sperm production.
Okay. So for a guy like myself, who too much information coming, but I've been snipped.
Here we go. Yeah.
I don't need to worry. I don't need to worry.
Yeah.
But for younger fellas, so presumably guys that, well, I mean, like theoretically we can have kids until the day we die, but maybe a little bit younger, like in their 30s, maybe in their early 40s, that want to have kids, but also want to try TRT. They need to be really aware that they're going to shut down this whole process. So is there let's say a countermeasure to ensure that you can still have adequate spermatogenesis and still be on TRT?
I mean, I think there's a couple of things that sort of answer that question. And that one of them, there's a little bit of data that concurrent use of HCG injections. So HCG is a synthetic version of that Liebig hormone. And so theoretically, it's, the exogenous testosterone shuts off our own pituitary secretion of that hormone. But then with concurrent use of these HCG injections, there's a little bit of data that some guys preserve their sperm counts, at least for a while. it kind of slows the decline. I would say in my real life, there's a few papers out there. My real life experience with it has been pretty so-so in that regard. But that is one possible thing. I mean, another thing to talk about is, or I think that's important to talk about in this discussion, is that there's evidence that like stopping the testosterone, 99% of guys' sperm production will come back. But then how long it takes, we don't know. Just stopping the testosterone cold turkey, I believe there was a paper that showed that like 60% of guys after 6 months regain sperm in their ejaculate, 95% after 1 year, and then maybe 99% by a year after that. And that's just doing nothing but stopping testosterone. You feel like crap for a few months, and before your body kind of starts making it again. And I do think, and so I think that's something that's kind of important to talk about here too. You can stop testosterone, and then you could start guys on different medicines, HCG, Clomid. If you've got just a lot of money, there's a synthetic version of that FSH where like you'd probably get sperm back in your ejaculate to some degree by 3 months.
Okay.
And kind of that 3 to 6 month range. It might take a little longer for it to reach its peak, but like there are some things you can do to make it faster. And then then the last thing is what this paper was about, where with this kind of a newer testosterone formulation, it's called Natesto, where it's this kind of short-acting intranasal testosterone agent. It's like since it's shorter acting, kind of more closely mimics our body's sort of natural rhythm of testosterone throughout the day. There's pretty good evidence that it doesn't suppress. It's an exogenous testosterone agent that does not shut down your sperm production. And then what our study was about was when, like in guys who are on testosterone, stopping the testosterone injections or the topicals and transitioning them to the intranasal, they got sperm production back within about 3 months.
Okay,
sorry, that's a lot. That was a lot of stuff.
That's awesome.
Sorry.
That's awesome.
Yeah.
I just want to see if I follow. Okay, so
yeah,
you mentioned the intranasal, which is Natesto, but you also talked about the other ways to do testosterone replacement therapy, which includes injections and creams, if I'm not correct. And I think there's pellets as well. So what you're saying is the more traditional way of being on a testosterone therapy is to do more of a large bolus, if I understand correctly. Like you get an injection's presumably given you, and I've never done it, so you can help me with this. It's one injection once a week, once every 2 weeks. So you're really spiking testosterone levels. Did I get that right?
Yes, typically. So with the injections, there's honestly a lot of different ways that you can administer it in different time intervals, and I usually typically have had guys on one injection once a week. I do have some guys out there where we're doing smaller injections a couple times a week. I'll get guys referred to me who have it prescribed by their primary care doctors who are on a shot every 2 weeks. But all that to say, you're exactly right. It's meant, I think the half-life of that medicine, so like how long the medicine takes to be metabolized by your body, is about 10 to 14-ish days. And so it is made to last a little bit longer. Yeah.
Interesting. Okay, so if I understand correctly, you have, like everything, you have to weigh the pros and the cons. When you're doing injection-based TRT, you're getting a larger volume of testosterone that is meant to slowly come down in your bloodstream, which gives you about a week of higher levels of testosterone before you have to bump it back up. But it also comes with increased levels of, I'm assuming, things like estradiol, which is, I think, something we should talk about, and other, I would say, counterindications. I don't know if I'm saying that properly. When you have a large increase of testosterone, so is that something that may be a symptom, or a symptom that an individual, a man, might not want? Is those counterindications kind of going up too fast at too great a quantity. Is that fair?
I think that's pretty spot on. So it does probably have the highest side effect risk because of exactly what you're talking about. You kind of you get that sort of peak that kind of lingers for a little longer, and so it can be associated with things like higher estrogen levels. One side effect of most forms of testosterone is your blood counts will trend up, and sometimes it can reach a level where it can, over a long period of time, it could be associated with an increased risk of cardiovascular events, so heart attack, strokes, that sort of thing. And so you have to donate blood at regular intervals and that sort of thing. And there's a few, I don't want to say workarounds, but it's something, it can become something you have to watch very closely, and sometimes can be a reason where maybe that treatment type ain't it for you, But yeah, all that to say, you're exactly right. The injections, they've been around for a long time. They work pretty good. Since they've been around for a while, costs, some insurance coverage for a lot of these things just kind of stinks anyway. But cost is usually a little bit more palatable sometimes with those if insurance doesn't cover it. But it does have the highest side effect risk.
Okay. So if then you switch to something that is more short form, where you get the nasal, I don't know if you call it an injection, but a nasal spray, nasal gel. I'm assuming though you're going to need to do that on a more regular cadence. So rather than just have one, let's say, injection a week, you're doing a spray regularly. Is it 2-3 times a day where you just have to remember, hey, I gotta spray this in so that you can get a more level kind of testosterone concentration? Is that the benefit of that form?
Yeah, once again, spot on. Yeah. So it's FDA, the intranasal, and it is an intranasal gel. So it's not like a saline that you snort. You kind of put it in each nostril, like kind of apply it to the inside of each nostril, massage the bridge of your nose, and it absorbs over the course of an hour or so. Mm-hmm. And it's FDA approved for 3 times a day. And what that means is, a lot of the initial studies to show that it's safe, they use it 3 times a day. I will say I usually start guys off on twice a day for exactly that. 3 times a day is hard. It's hard to do anything 3 times a day. And so
Agreed.
Like 2 times a day is still, and that's 2 times a day, that's not nothing. But that's usually my starting dose. I usually have guys start out at twice a day. And for the vast majority, like that gets them where they want to go.
Okay. And is it safe to say that if you're doing using the Natesto, would you just not be able to get necessarily your testosterone levels as high as you would if you were doing injections, by virtue of the fact that there's a smaller amount intranasally than if you're doing an injection?
Not necessarily. And I guess one of the I don't know what the right word, problems, or it could be a good thing or a problem in some cases with the injections, is the dose can go as high as, there's an infinite amount of medicine you can inject, right? Like the dose with that can go as high as I don't want to say you want it to go, because but like it's like I said, there's a lot of, I don't know if customization is the right word, mm-hmm. But like that's why the bodybuilder guys, like they're using they often use some other products, but like with the injections, that is something where like you can go very high. And so it's not even necessarily like, it's suspended in a different type of oil. So it's not exactly like apples to apples when you're comparing doses, because mm-hmm. usually the chemical response with the Natesto, like as you saw in our study, like the levels we measured out were in the mid 600s versus like low 700s of what the patients were mostly like doing the injections. So like doing the chemical response can be similar, right. But then like doing on, I don't want to use the word, reasonable doses of the injections, probably the results are similar. Does that make sense?
Yeah, it does. And just based off what I read in the paper, right, because you've now just increased the amount of, let's say, applications, you're going to have a more stable level of testosterone, which is, if you take the average of how much testosterone you have in your bloodstream, free testosterone, when you do an injection, they basically average out to the same amount. And obviously there's a variability based on who you are, your genetics, all these other factors too, because we haven't even touched on, sex globule binding hormone, which, for myself, it's kind of like an education in terms of, wow, there's a lot of chemistry going on here. And, personally speaking, I only found out about a year ago, thanks to Men's Health in an article, that I have gyno from when I was a kid. And, that's a concern. So is that something that is technically, if you're using a product that's an intranasal gel, because the estrogen levels aren't being spiked as high, would it reduce the chance of getting gyno? And gyno, just to be clear, is, as we call it in the gym, bitch tits, right? Like, is that, just to be clear,
that's the medical term.
Is that the medical term?
Yeah, in the textbooks. Yeah, that's the medical term.
Awesome. Awesome. But I mean, I've already got them. So nice. I told my wife, like, hey, look, I think next year I'm going to get my tits done. She laughs, when I say it. But but it is a concern for a lot of guys, right? And we saw Fight Club, Meatloaf. He was a testosterone abuser, and you get those bitch tits, but in all seriousness, we want to control for that because aesthetically it doesn't look great. Is that something that is reduced by using an intranasal gel because it keeps the hormone levels relatively stable, and so we don't see the spikes in estrogen, which, and correct me if I'm wrong, that's what causes the gyno. Am I right?
Yeah, I think everything you said there is spot on. But I mean, let's talk about like the estradiol a little bit. So estrogen is one of the things that our body metabolizes testosterone into kind of naturally. So, and we as guys, we need some estrogen. It's not a bad. I see not a small number of patients who just want, who want to be like, just started on the estrogen blocker. Like, this is the woman, or like, this has to be bad, right? And we need some. It plays a role in our sexual function. There are studies that show if we just cut your estrogen down to zero, it can have negative sexual function side effects. And there are some studies, I think, that suggest that like actually a lot of our libidos comes from estrogen. And then it also plays a role in our bone health. So like we don't want zero estrogen. Estrogen is not a bad thing in and of itself, but sometimes, like exactly what you just said, if our testosterones are going up, most of the time our estrogens will go up at least a little bit, but then on certain things, sometimes with the injections, like if you're at a sustained higher level for longer, more of that testosterone is getting shunted down that sort of estrogen pathway. And so theoretically, higher risk of nipple tenderness, higher risk of breast growth, that kind of thing. And that actually, overall, like it's not a high risk. I guess not a high percentage of guys get that, but it's not zero either.
Right. Okay. So in terms of benefits, and I also want to touch on, duration of treatment from folks that I've seen start going on TRT. Their life improves. They feel better. They have more energy. They're like, yeah, man, I got my fire back. I recover better. It seems like almost too good to be true for a lot of things, but there's got to be some downsides. And I want to know a little bit more about that. Like, is it something that once you start, you can never pull back off? So are you going to be constantly dependent on it? Because that for me is a big concern. And, what are some of the long-term health effects that we should be aware of as well?
Sure. No, so you're exactly right. It is something that once you start it, whenever you stop it, your testosterone levels would just revert back to your baseline. So I think, and that's a pretty common question I get, or, when I see patients who are started on testosterone from somebody else, like they don't necessarily get told that like, this isn't meant to jumpstart your own testosterone production. There's nothing that we have to offer that can jumpstart your own testicular function in a way that it stays after we stop treatment.
Right.
And so it's possibly something that you'd have to be on for the rest of your life as long as it's helpful. And so, I mean, we've already hit on a few of the possible side effects, but I mean, you can have mood lability, hair loss up here, hair growth everywhere else. We talked about the nipple tenderness, breast growth thing. We talked about your blood counts trending up, which quote unquote your blood gets a little thicker, which can theoretically be associated with blood clots. Although I would say like the data they're not, But I think a few things I think important in this realm too are, for a long time there was some debate over, is testosterone good or bad for your heart in the long run, based on some studies that came out 10 to 15 years ago. But with the data that we have now, it shows that doing testosterone replacement the right way is safe for your heart. There was actually a really good study that came out about a year ago, like the best one to date, that found no increased risk of cardiovascular events, like basically, once again, doing testosterone treatment, testosterone replacement the right way. And there is actually, but I think there's evidence if you're going too high over too long of a time, probably bad for your heart. And there's evidence actually if your testosterone is really low over a long period of time, that's probably bad for your heart too. Mm-hmm. Mm-hmm. The other thing, so how do I want to explain it? Testosterone stimulates our prostates. But then, and so there's a lab value called a PSA, it's a blood test. It stands for prostate specific antigen. It's used as a screening test for prostate cancer. And typically since testosterone does stimulate your prostate, like when you get started on treatment, oftentimes you'll see a little increase in that lab value. But then if it jumps up a lot, or you see kind of a sustained upward trend over a while, that might mean that something's going on that like a urologist would need to look into. Mm-hmm. But I say that as kind of a lead in, but that there is no evidence that testosterone causes prostate cancer. Because for a while, that was also something that was kind of, does it or does it not? But so those things, so no evidence that testosterone done the right way causes an increase in cardiovascular disease. And then there's no evidence that testosterone causes prostate cancer. But those were things that historically there's been some debate.
Mm-hmm. Okay. Thanks for clarifying that. Because that helps not only myself, but those that are listening as well, if they're going to make a decision and talk to their doctor about this. One thing, though, that I think a lot of guys are kind of confused about is if they start on a testosterone therapy, are they going to get jacked just by virtue of taking testosterone? And I think you're a better reference than me saying what the obvious is, but it in reality, right? If you're on testosterone replacement therapy, you're not just going to get jacked, right? You have to put in some work.
That's exactly right. And I think you kind of hit on some of this stuff earlier. Like, I feel like if you've got low testosterone, the injection is half of it, and the other half is kind of on you. And it's, you get exercise. Are you sleeping enough? Or how are your stress level? Like those kind of things. It's like, I can give you, if you have low testosterone, like I can give you testosterone, your energy level is going to be better. But if you're only sleeping 3 hours a night, you're still going to be tired all the time, right? Like, so half of it, I think, is me, like managing the hormonal chemical side, but then the other half kind of falls to you guys as patients, like to kind of do your part. And I think those are the guys that derive the most benefit.
Mm-hmm. Yeah, that's a great point. And coming from you, it's a lot more credible than like, guys, you can't just sit there, jab your butt full of testosterone and expect to have abs by next week. Like, that's not how this works. You can still be chubby and be on TRT. Right. So this has been really informative because, I mean, this is the most in-depth conversation I've had on the topic. And I've got a lot more clarity as to what this could look like in the future if I do decide to go down this path. But also, what are some of the things that I need to be really aware of? Because this is a big decision. This shouldn't be just, you know what, I'm feeling a little bit down, maybe I should just start a TRT therapy. It really needs to be something that I need to consider with my doctor, but also something I'm going to talk to my wife about as well. That I think ultimately needs to be a big decision that's taken obviously for myself, but to help benefit just my presence and my energy levels. So, therefore the family a little bit better, and, I'm able to be a bit more present with the kids. I do see the long-term benefits, but like all things, nothing can be 100% benefit without some repercussions and some consequences. So I appreciate all the info and explanations you've given here, Luke. It's been much appreciated. In terms of moving forward, you did some research here. Are you doing any more research in the field of testosterone?
Not at this time. I don't have anything cooking actively. Sometimes, what I do is kind of a small community, so sometimes things kind of fall into our laps, but I don't have anything cooking currently.
Okay. All right. And in terms of folks that want to get to know you a little bit better, I know you have an account on Twitter, on X. Are you looking for veteran barbarians to come follow you on X? Is that something that we can share with folks?
Yeah, absolutely. And I also have my personal kind of practice website is greensboro-menshealth.com. That's where I live and work. So feel free, it has, I think, a little bit more information about low testosterone, how to reach me. But yeah, I'm on X. I'm not very, I lurk all the time. I'm not a very active poster anymore. But you can definitely find me there.
Awesome. Well, that's a good thing. You're looking out for your mental health, because X is just a wasteland. So,
oh man, it's the best of society. It's the worst of society. Just depending on the second.
Absolutely. I have to totally agree with that. So greensborohealth.com, we'll put that in the show notes, as well as your X account. And thanks so much for coming on the show and sharing your thoughts. Do you have any last words of wisdom before we sign off today?
I mean, I appreciate you having me. I mean, I think just if you ever have any questions, I think this kind of stuff, we're guys, we don't like going to see doctors. But just find someone who's interested in it. Find someone who's willing to talk to you about it. And if you ever have any, like I said, just don't be afraid to talk to the right guy about it. And I mean, the initial evaluation is pretty easy. It's just checking some blood work, that kind of thing. So, but once again, just never be afraid to go talk to somebody about it, especially find someone who's interested in it, who's willing to kind of sit down and talk to you about it.
Awesome. Well, thanks so much. I know this is going to help the community greatly. And folks, don't forget, train hard, fight easy. See you in the next one. Peace. Right.